Good afternoon. I just wanted to reach out to the community and tell everybody some of the things that are happening at BACH in the next coming several days. One thing that we're doing, and many of our community members are interested in, how we're reopening services and what's the time frame for that looks like, and what kind of process are we going through. So I have to tell you that we've gone through a very deliberate process to open up our services and make sure that they are safe for both our own staff and for any patients that are coming to receive services. Each and every service line, each and every department has gone through a risk assessment that's been pretty thorough. And then after that risk assessment has been created, the deputies and other command presence goes through and inspects each of the departments to make sure that they meet the requirements of the risk assessment. And each of those risk assessments I personally approved. Now, what I need folks to remember is if you're coming into the hospital to receive a service or for any reason whatsoever, you're more than likely going to be within 6 feet of somebody. So I need you to bring your face covering and I need you to wear it at all times, but especially if you cannot maintain the 6 feet of social distance that we require. One of the services that we're most proud of and that is very, very busy for us is our women's health department. And so what that looks like as we go to open it up is our OB appointments. We were doing, several of those. We were doing what we could do in a virtual format. We're actually going to move to, in July, we're going to move to all of our obstetrics and postpartum appointments are going to be face-to-face. Similarly, our gynecological services, we're starting to open those. They're going to be very limited. Priority is going to be to active duty, especially readiness related exams. So anybody that has an abnormal pap smear or needs a contraception appointment in your active duty, we're going to be able to work you in. Otherwise, quite limited. Gynecological surgeries are going to be limited only to urgent and emergent or in somebody that's readiness related. Now, we're going to obviously hope to expand soon in the next 2 or 3 months, but don't be looking for those to expand greater in shorter time frame than that. Remember, there will be COVID testing. That's the nasal swab for anybody who's going to be admitted. So that means if you have a scheduled induction or a cesarean section or you're coming in to have your baby, we're going to do the COVID testing on anybody that's inpatient. And again, safety for you, safety for your brand new baby, and safety for our staff. Our visitor policy on that hasn't changed. One inpatient visitor is allowed. It's the same patient throughout the entire hospital stay. And if you think about it, if you have more than one visitor, say you have 2 visitors, you've just doubled the potential exposure for COVID-19. Now, our community, as you know, is going through an uptick. We're seeing more and more cases. Luckily, in general, they don't seem to be quite serious, but that doesn't matter, right? Our job is to mitigate the risk and protect our most vulnerable patients, including our newborns. And so I know a lot of people find that inconvenient, but typically you get out of the hospital 2 days to 3 days after you have a new baby, and grandparents can come and see that baby at that time. And generally what we found is that mother-baby bonding time that's largely uninterrupted, it's been, a lot of patients have found a lot of value in that. So please understand it's for your safety, it's for our safety, and I'm sorry that it's inconvenient, but really it's the safest thing to do. Typically, we don't want to have any visitors allowed, like I just said. There are a couple of exceptions. We want you to go ahead and feel free to bring that newborn if you're coming in for a 6-week postpartum checkup, or if you have that immediate blood pressure checkup or a wound checkup, right? So if you're having one of those immediate postpartum appointments to check up on mother or baby, obviously feel free to go ahead and bring the newborn. All of our inpatient services and routine services are going to be open by appointment only. We're not going to have any walk-ins. That's one way that we can control the traffic flow and the throughput, and that's just another safety measures. And that's going to include all the immunizations for all ages. So a lot of folks are interested in getting immunizations done. We're going to start those immunizations for all ages. Typically, those are requirements for school, and so we're getting at that. Similarly, we're doing physicals for school-age children. Physical isn't typically required for school, but if you want to do school sports or camps or something along those lines, athletics, the physical is required. We're going to be doing those at Screaming Eagle Medical Home and Bird Clinic starting July the 7th, and you should be able to call now and get those appointments. We're only scheduling appointments month by month right now. Typically, we try to schedule 2 to 3 months out, which allows some planning, but the fact of the matter is our situation is very dynamic right now, and as we have the rheostat approach to turn services up or down, we really can't plan out more than a month in case we have to curtail services to treat people who are having more acute illnesses in the future. Soldier services are starting to open up a little bit too. We're going to maximize virtual appointments. We're going to continue to do that for all of primary care as best that we can. So any soldier health open for routine appointments literally are by appointment only. Similarly to every other outpatient appointment, those are going to be at either Byrd, LaPointe, or Campbell Army Airfield. And we're going to open up with new appointment hours starting on July 6th. Now what we're trying to get at here is meeting the commanding general's intent to keep that sacred PT time sacred, right? Keep folks out there. Prevention is the best cure. If you can keep healthy, then adhere to that performance triad, one leg of which is physical activity, then you'll need less treatment in the future. So our hours will be 9 a.m. to 4:30 p.m. Monday through Friday for routine soldier care. Acute care will be available starting at 8 o'clock Monday through Friday, and that's going to be more along the lines of your sick call. Your division provider should be there with you at PT, and they can help if you have any other reason to be seen. And of course, as always, if there's an emergency, go to the emergency room. Soldier health ancillary service hours are also going to adhere to those PT hours, right? So we're starting at 9 a.m. to 4:30 p.m. for routine care. That's going to be Monday through Friday, and that's going to include things like lab, radiology, audiology, and then the SRP side, right? Soldier readiness processing. Ancillary acute care services again starting at 9 for routine care, and acute care starting at 8 Monday through Friday for soldiers. For specialty services, we're starting to open those up as well. Behavioral health is one of the services that we really have a demand for. Our inpatient ward is already open. It's going to continue to be open, and we're going to expand that as best we can in a safe way. Our embedded behavioral health units are going to go back to their original footprints and be more embedded instead of consolidated the way that we were doing it to try to maximize the COVID manpower as we do screening at doors and stuff like that. Group therapy is going to open up. I've heard a certain demand signal for the group therapy. I think a lot of people find it efficacious, so July 13 we'll start that up. And then family advocacy is still open and always will be, right? So intrepid spirit patients, we're going to start to see those on July the 13th. The sleep lab is going to be open at any time. Pretty soon their risk assessment has been done, their walkthrough has been done. They should be opening up their services soon. And then similarly, radiology, I mentioned this on one of the previous town halls, plain film x-rays, CTs, MRIs, ultrasound, nuclear imaging, and mammography are all open. The only thing that's not open is fluoroscopy, and that should be open at any time. And our general surgery, right? So our operating rooms are a high-risk area. That's something that we've taken a lot of specialty care to make sure that we got right. And we're going to start rescheduling those previously scheduled surgeries. Obviously, urgent and emergent surgeries have been ongoing, and we're going to get to more elective surgeries now that we have the freedom to do that. Other specialty services similar to the soldier services, audiology, optometry, ophthalmology, in the operating room, and pharmacy services. You should see an expansion in each of those. Again, everything that we're doing in a way that we can maintain proper safety. I know pharmacy is a big topic for everybody's mind, and we're going to find ways to continue to make that as efficient as possible. All new prescriptions, we want you to continue to drop off and return later to pick up at least 2 hours later. The lobby waiting areas, again, for COVID reasons, we're continuing to restrict the patient medication lobby waiting area. So we want folks only that have been notified their prescription is ready and they're picking up. So we want you to drop off, go do what you need to do, and then once you're notified, come back and pick up. There may be a small waiting period, and that's what we want the lobby waiting area for. Any refills can be picked up at Town Center Pharmacy, and you can do that 3 days after you've made the request. So remember, you have to call in and request your refill. You can do that with certain medications only after a certain time period has passed, and up to 3 days after you've made that request, then you can go in and pick it up. The refills, you go ahead and call 270-798-DRUG. Easy enough to remember, 798-DRUG, and then you should be able to pick up 3 days after that. All services except for the emergency center will require appointments. And again, our visitor policy remains the same for inpatient and outpatient. No visitors should come to a primary care visit or any outpatient visit unless there are a couple of exceptions. If you're a parent accompanying a child, the child is the patient, or an elderly person or a disabled person that needs some additional help, you can come with them. Or a parent who's bringing multiple children who have scheduled school or sports physicals to an appointment, right? So all of the kids have appointments. All children need to have an appointment to be in the hospital service at this time. Not really they shouldn't really accompany parents unless the child themselves has an appointment. And again, for an inpatient stay, only one visitor throughout the entire process. It's really just the safest thing to do.